Hey guys, welcome back. It's Living Vegan here, and today I wanted to discuss acid reflux and hiatal hernias, how to prevent and treat them if you already have them. Acid reflux is an excess acid in the stomach that comes up through the esophagus, burns, gives you a bad taste in your mouth. Let's go over the prevalence. 1 in 5 Americans are treated for acid reflux and hiatal hernia every year. If you look at other countries, like say Africa, their prevalence is about 1 in 1,000. So why is this happening? Well, it's been linked to high-fat diets. Standard American diet is high in fat. The animal protein, animal fat, all their foods have a lot of fat in them. So therefore, Americans eat a lot of meat, increase in gas, increase in hiatal hernia prevalence. So how do we prevent this? One way is eating more plants. More plant-based diet increases your fiber. Fiber gets through the stomach a little quicker, less gas production, eases bowel movements. If you're hydrated, high fiber diet, you don't have to strain to have your bowel movements like you do, like I said, a lot of standard American gas. Constipation is really prevalent as well. So let's go into hiatal hernia and what it is. Hiatal hernia is part of the stomach that pushes up through the diaphragm. Our diaphragm separates our chest cavity and our abdominal cavity. Once part of that pushes up through there, it makes a little pocket. It makes it more accessible for the gas to come up through there, burn in your throat, can develop, increases your chances of cancer. So what do we do to prevent or treat this? Well, we'll increase our fluids, of course. Hydration always helps. Increase our fiber intake and decrease our saturated fat intake. What can that do? Well, and how does it prevent or treat it? Well, if you have more fiber, more fluid in your system, you're going to have bowel movements easier. And what do you say? Well, what's bowel movement have to do with it to the other end? Well, the more pressure you put to have a bowel movement, the more abdominal pressure you develop, the more chance that's going to push up through your diaphragm, make a hiatal hernia, or push more gas into your hiatal hernia, causing reflux. Also, 2 other side effects that come along with this, if you're having to put more pressure on your abdominal cavity, will be hemorrhoids, everyone's favorite topic, and also varicose veins. Everybody's like, what do you mean varicose veins? Well, you're putting more pressure there, pushing more blood down, it's going to stretch out those veins, more varicose veins. So how does the standard Americans treat this? Oh, we give everyone a proton pump inhibitor or a reflux medicine, name a few like Pepcid, Zantac, Protonix, etc. These meds aren't made to be taken for years. They're made to be taken for a week or 2. And we've put people on them for years now. What that does is increase your chance of osteoporosis. It leaches calcium out of you. So we're not going to treat the osteoporosis because we're developing it from our meds for our reflux. So how do we prevent osteoporosis? More plants as usual. Anyway, these are just some things on hiatal hernia, things to do, not to do. There are some other treatments that people use. If the hiatal hernia gets bad enough, it is surgical. But like I said, it's so treatable just with your diet that many people could get off their reflux meds and decrease their chance of osteoporosis, decrease their chance of hemorrhoids, decrease varicose veins, and decrease the chance of any risk associated with the surgeries. So anyway, this is just hiatal hernia and acid reflux. Simple things to do, changing your diet. You'll be amazed at the relief. So anyway, any questions, comments, leave them below. And if you need more information on this, Dr. Greger's got a great video on nutritionfacts.org about this. It's where I got some of the information and they got the idea to discuss it. So anyway, please like, share, and subscribe. And just remember, carbs make us happy.